po inanunsyo ng IATF yung pag-relax po ng ilang protocols na umiiral sa GCQ areas. May epekto kaya ito sa isinasagawang pananaliksik na Octa Research Group patungkol po sa ating laban sa COVID-19. Ngayong umaga makakausap po natin si Dr. Butch Ong, kinatawan mula sa Octa Research Team. Good morning po, Doc.
Good morning at good morning sa ating mga tagapanood at nanonood at nakikinig sa programa.
Opo, Doc, bigyan daan ko po yung pinadalang tanong ng ating mga kasamahan sa media. Unahin ko na po ito. Mula kay Red Mendoza ng Manila Times, sa tingin niyo po ba okay lang ba sa gobyerno na mas lalong luwagan ang mga restrictions sa bansa tulad po ng sine, museo, arcade at iba pang mga pasyalan?
Yung mga restrictions na binibigay natin or yung mga preventive measures pala na binibigay natin sa mga venues, sa mga facilities ay nandiyan naman, alam naman natin kung ano yung dapat gawin, yung ventilation dapat open, nagsusuot ng mask at face shield yung mga tao at may proper distancing. Mas lalo na kapag maliit o kaya confined ang isang venue, kailangan na 50% or less lang ang occupants ng venue na yon. Kung magagawa naman natin lahat ito, posible naman talaga na mag-open talaga yung mga facilities and to make the wheels of commerce moving. Naintindihan naman natin na kailangan naman talaga ma-stimulate yung economy natin at this point in time. Ang kailangan lang, sumunod lang tayo sa ating mga minimum health standards.
Opo, mula pa rin po kay Red Mendoza, while our numbers daw po are getting steady, do you think this lifting of other restrictions is appropriate?
Sa NCR at sa Pilipinas ay nakikita natin yung trend ng reproduction number o yung R value natin. Talagang steady lang siya, no? Since the start of January, ang reproduction number ay it's hovering around 1.0, no? So it means na yung number of people being infected outside is just 1:1. No? Kumbaga, if one person is infected, he can only infect one more other person. Ngayon, we are in a precarious balance ngayon. No? So, maaaring umusbong pataas yung number of cases or maaaring bumaba naman. Depending on how we perform or how we implement the minimum health standards. Kailangan lang talaga natin, especially the venue or facility managers, the companies, kailangan mas stricto talaga sila sa pag-promote at pag-implement ng minimum health standards. Again, right now sa Philippines, ang reproduction number is at around 1.0 to 1.01, 1.02. Medyo steady tayo since the start of January. And to decide now to open commerce and industry, we must be more vigilant ngayon. Siguro, ma-implement natin na stricter yung standards na sinet ng IATF.
Opo, may tanong po si Rida Reyes ng GMA7. Yung iba po ay nabanggit nyo na, pero ang follow-up po niya, do we see a possible shift to MGCQ starting February 16 following an easing in restrictions?
Right now sa Octa Research Team, pinag-aaralan din namin yung effect ng mga bagong variants. Dati, last year, nagkaroon tayo ng bagong variant, yung tinatawag natin na D614 variant na humingi ng 2-week timeout yung mga healthcare workers. Kung naalala nyo, at that time, bumalik tayo sa MECQ ng 2 linggo. At that time, yung bagong variant was known to be more transmissible. Ngayon, we have a new variant who came in, the UK B117 variant, which is also more transmissible like last year. So maaari talaga tayo mag-open ng industries but very, very carefully and very, very cautiously. Unlike last year, mas maganda ang ating hospital capacity. The government has improved the number of COVID wards, the number of doctors, the number of healthcare workers working against COVID-19. Last year, hindi masyado ganun kataas. So, with a balance of more healthcare workers and the entry of new variants which are more transmissible, kailangan natin mas maging vigilant. Maaari natin i-monitor every so often yung trends ng iba't ibang LGUs, lalo na ang Metro Manila, we still consider NCR as the epicenter of the pandemic here in the country. So, kailangan natin when we make policies, no, ang aming bungkahi ay when we make policies, we must base it on data, we must base it on evidence, and from our previous experience with COVID last year. So maaari naman, kailangan lang talaga natin paigtingin talaga ang minimum health standards, no? At i-improve pa natin ang testing capacity at i-improve pa natin pa ang hospital capacity sa Pilipinas.
Opo, tanong pa rin po ni Rida Reyes ng GMA News, DOH has detected po 19 additional B117 variant or UK variant cases. More than 2,000 din po yung naitalang COVID cases kahapon. Bukod dun sa UK variant, ano po ang dapat pang gawin ng government para matiyak na hindi pa makakapasok sa bansa yung pong sinasabing ibang variants of concern, Doc?
Oo, yung variants of concern, yung sinasabi namin pag nababasa nyo yung VOC, variants of concern na yan, no, ay specifically yung Brazilian and the South African variant. Because those variants seem to escape the immune system of people who have been previously infected with COVID-19. And some studies have shown sa ibang bansa na yung mga na-vaccinate, no, against COVID-19, no, kapag natamaan ng variants na ito, yung dalawang variants, no, they have less effectivity. So therefore, it is more important for us now to safeguard our borders against the entry of these new variants. No? Hindi naman natin pwedeng ipigil yung mga ating OFWs na uuwi, pero kailangan siguro i-quarantine, i-test agad, i-determine agad kung ano yung variant at dala, if ever mayroon silang positive, at i-quarantine ka agad sila para hindi makahawa sa community. No? Again, no, even with the new variants, ganoon pa rin naman ang behavior and characteristic ng COVID-19. 14 days pa din quarantine, we still wear masks, we still wear face shields, we still do physical distancing, and we still wash our hands either with soap and water or with alcohol. Ganoon pa rin naman ang gagawin natin. No? Even if there's a new variant, it's the same behavior, the same minimum health standards we have to follow. And if the vaccine comes in, that is another extra layer of protection para sa ating society.
Opo. Doc, panghuling tanong po niya, no? Maraming Pilipino na daw po ang naniniwalang the worst of COVID is already behind us. Ano po ang masasabi natin dito?
Well, actually, dapat mas maging vigilant pa nga dapat tayo ngayon. No? Ngayon, alam natin na the virus mutates very frequently. Dati nagkaroon tayo ng 2 variant, 3 variant na pumasok sa Pilipinas. No? And the worst is not yet over, I think, but we are beginning to arm ourselves better. Yun na lang gusto ko sabihin, no? The government is doing its job to arm ourselves better with the incoming influx of the vaccine very soon, the improvement of the healthcare capacity, the improvement of the testing capacity, and sana ang susunod nating level ay mas talagang paigtingin pa natin yung ating implementation. No? Alam ko na we need to open industries very soon because of the economy. We have to stimulate the economy, no? But it has to be balanced pa rin talaga with our own discipline. Sinasabi ko nga palagi, no? Ang pinakakalaban ng COVID-19 ay isang disiplinadong mamamayan. No? If we are disciplined enough, hindi na ito kakalat sa community, no. And one more thing pala, no, regarding vaccination, no, we need to learn more about the vaccine, no. I admonish the public to learn, no, about the vaccine and the vaccination program, no. Maraming tao ay ang hesitant. Narinig ko kanina, no, sa balita ninyo na may mga hesitant pa sa vaccine. And I believe it's because hindi pa sila masyadong aware of what the vaccination program is, what the vaccine will do, what the benefits of the vaccines are, no. So please learn more about them, no. Read on them and listen to programs na kaya nito to learn more about what the vaccines will do.
Opo, para sa inyo, Doc, para sa inyo, mas dapat mauna yung sinasabing vaccine rollout bago po ang pagluluwag?
Para sa amin kasi, no, it's important to protect the citizens before they're able to go out, no. Yung unang layer ng protection natin is our self-discipline, yung pagsuot ng mask, yung minimum health standards, no. And so far ang katanungan ay dumadami naman ang variants sa labas. Hindi pa rin natin na ibababa talaga ang COVID-19 cases sa Philippines ngayon, no. And when we open industries, of course, the exposure of the Filipino to COVID-19 is greater, no. Mas exposed sila dahil mas open ang industry. Para sa amin talaga, or actually personally din, no, as a physician, a doctor, no, gusto ko talaga mas protected ang mamamayan natin when they go back to work, no, when we go back to industry, to retail, to manufacturing, etc., no. And to study what the new variants will do, no. The new variants may affect children more than before, so this has an impact in opening schools, no. The new variants which are coming in might be affected only against several vaccines. So we have to study the characteristics of these new variants. But for now, yung B117 UK variant is still effective pa din yung mga vaccines na papasok sa Pilipinas against that variant. Ang tinatakutan natin talaga, or yung ating siguro sabihin natin yung caution na lang natin, ay yung pagpasok ng mga South African variant at saka yung galing sa Brazil, no? So yun lang ang ating payo sa mga kababayan natin.
Opo, Doc, kaugnay sa mga pulisiya na ginagawa po ng gobyerno, no po, base po kasi sa pag-aaral ng ASEAN Study Center, karamihan daw po ng Filipino respondents ay nagpahayag ng kanilang disapproval sa pandemic response ng pamahalaan. Magkaiba po ba yung resulta nito sa sariling survey ng Okta Research kung saan ay highly compliant po ang mga Pilipino sa patakaran ng gobyerno? Ano po ang tingin ninyo ang dahilan ng magkaibang resulta, Doc?
Well, we did a study about a month ago, no, on the respondents from NCR, the National Capital Region, no, on their ability or their kumbaga kung paano sila sumusunod sa minimum health standards. And it's very encouraging actually. About 70 to 80% of the respondents in NCR follow the minimum health standards. Marami ang sumusuot ang mask, maraming sumusuot ang face shield, marami ang nag-follow ng social distancing at naghuhugas ng kamay. No? So with regards to the study that Okta did about a month ago, karamihan ng ating mga kababayan sa NCR compliant sa pagsuot ng sa pag-follow ng minimum health standards. And natutuwa naman kami, it is across all classes of society, from class A to even down to class E. Sa society natin. Sumusunod, natutuwa naman kami that the government has actually perhaps implemented the education program or advocacy program on the use of these minimum health standards. No? Mas maganda sana kung 100% na lahat ay sumusunod. No? Mas magandang level of protection yon against COVID-19 pag lahat sumusunod. So para sa amin, although I want to have another study as a follow-up to that study done in December last year yun, na pinapublish namin noong January, na sumusunod naman ang mga kababayan natin sa minimum health standards.
Opo, Dr. Ong, nakalculate nyo rin po ba sa Okta Research kung kailan po matatamasa ng Pilipinas yung tinatawag pong herd immunity, bunga po ng pagbabakuna? Ano po yung lumabas sa datos ninyo?
We must be able to immunize or vaccinate at least 60 to 70% of our population in order to get herd immunity. And that's base na rin yan on the reproduction number ng Pilipinas at yung effective rate ng vaccine. So iba't ibang klase ng vaccine, iba-ibang brand ng vaccine, they have different efficacy rates. Merong 50%, may 90%, may 80% efficacy. No? But in general, given all of these, we must vaccinate at least 60% of our population. And I heard kanina sa balita dyan, na that the government's target is around 70%, 70%. And that's right smack in the middle of the targets to get herd immunity. So with regards to herd immunity, and we know na 60% at least at 70% ang gusto ng gobyerno, kailangan pa natin ma-improve yung vaccine advocacy at yung education ng mga tao with regards to the benefits and of course with regards to the different kinds of and brands of vaccines being procured by government para tumaas ang vaccine confidence ng public natin.
Opo. Dr. Ong, binanggit nyo kanina na NCR pa rin po yung nananatiling epicenter, pero nagbigay po ng red flag sa Cebu City dahil sa patuloy naman pong pagtaas ng mga kaso sa syudad. So ano po ba yung transmission rate sa Cebu at ano po yung posibleng dahilan po ng patuloy na hawahan doon?
Well, sa Cebu City, ayon sa latest report namin which we released yesterday, no, so we have a February 12 report from OCTA, Cebu City has a positivity rate of 10%, meaning 10 out of 100 people tested no, are found positive. Now, medyo mataas yan. Ang WHO has set the minimum at 5% lamang. No? So, medyo mataas ang positivity rate and maaaring ito ay dahil doon sa new variants na pumapasok sa syudad. No? And of course, tandaan natin, no, yung minimum health standards natin has to be strictly followed. No? With these new variants na mas lalong mas nakakahawa, kailangan mas maingat yung mga tao. Hindi ko naman sinasabing bawal lumabas, no? Ang sinasabi lang natin, sumunod lang tayo, no? Kapag nakita natin yung lugar ay maraming tao, more than 50% capacity yung lugar, iwas lang tayo and schedule another visit na lang kung kailangan puntahan, no? So, ang nakikita natin sa Cebu, mataas ang positivity rate, it's at 10%. The hospital occupancy at Cebu is 43%, which is actually medyo maganda. Ang hospital capacity na sinet ng Department of Health na medyo nasa red line na is at 70%, 70%. At ang Cebu ay at 43%. This is actually proof na tumaas yung hospital capacity ng Cebu City and the LGU did its work with regards to improving its hospital capacity. So, medyo mixed ang balita sa Cebu, no? May bagong variants, mataas ang positivity rate, pero ang hospital occupancy, ang hospital capacity naman nila ay umakyat.
Opo.
So, sa mga Cebuano nating nakikinig ngayon, no, mag-ingat talaga tayo, especially when going to crowded places, and always follow the minimum health standards set by the IATF.
Opo, 19 new cases po ang naitala ng Department of Health na bagong kaso ng B117 variant kahapon. Pero ayon po sa OCTA Research, hindi raw po nakikita yung indikasyon na malawakang transmission ng mas nakakahawang variant ng COVID-19 lalo sa Metro Manila. Sabi niyo po nasa best situation po ang NCR. So ano po ang naging basihan ng OCTA Research dito, Doc?
Well, it's actually quite a good indication, no? Well, the new B117 UK variant has already been found in Quezon City, no? Kasama yan sa na-report kahapon na 19 new cases. Isa yan sa mga syudad, yung Quezon City. And yet, yung ating reproduction number, flat pa din, as at 1.0. Ibig sabihin, meron ng balance yung pagpasok ng bagong mas nakakahawang COVID-19 variant and yung ating pagsunod sa minimum health standards, no? In NCR, at least I can say for NCR na lang, no, dahil doon yung datos natin. At least sa NCR, nakita natin na even though the new variant is found, no, in the cities in the National Capital Region, hindi nagkaroon ng surge at hindi nagkaroon ng uptick or uptrend ng kaso sa National Capital Region. And I hope it becomes a trend talaga na pababa na. No? Even with new variants, kaya natin, mga kababayan, kahit na pumasok na new variants, kaya natin talunin ang COVID-19. We just have to follow the standard set by the Department of Health.
Opo, kami po ay nagpapasalamat sa inyo, Doc, sa inyong binigay na panahon. Dr. Butch Ong ng OCTA Research Team. Salamat po, Doc.
Salamat na marami at magandang umaga sa lahat.
Salamat po.